Even before the Dobbs ruling, the 14 states with the most restrictive abortion laws had the worst maternal and child health outcomes in the country. Rachel Treisman, Associate Editor, Social Media and Digital Writer, Morning Edition, National Public Radio. Notes toward the People's Deeply Acrostic and/or Space-Time-Travel-Synchrony-Theme Communication Coordinated History of the United States, XVI. 1863. Wisconsin's abortion ban does not currently include criminal prosecution, bounty hunting on pregnant women obtaining an abortion, so one cannot yet expect to face prosecution for obtaining an abortion outside the state, but hey, who knows? Economic distress, in addition to creating the conditions for childhood hunger, physical health vulnerability, mental health vulnerability, and poor educational outcome, is known to increase the likeliness of child maltreatment, including neglect, abandonment, and abuse. School-to-prison pipeline statistics compiled by the Southern Poverty Law Center and the NAACP reveal that in Mississippi's Meridian County, 67% of the youth incarcerated in detention centers arrive there directly from school. Tennessee on Thursday, August 25, 2022 became the latest state in the nation to ban abortion, implementing a strict new law with no exceptions for rape, incest or fatal fetal anomalies, while subjecting doctors who choose to perform life-saving abortions to the risk of criminal prosecution. Victims of rape and incest in West Virginia are only exempted from the near-total abortion ban signed by Republican Governor Jim Justice on September 16, 2022 until 8 weeks of pregnancy for adults and 14 weeks for children. In 2020, Georgia had the country's fourth highest percentage of babies born with low birth weights, according to data from the Centers for Disease Control and Prevention. Recently, in a brief to the Supreme Court, 154 economists wrote that access to legal abortion has led to women attaining higher levels of education and professional occupations and lower rates of child poverty. Georgia has had one of the poorest records in the country of keeping pregnant women, new mothers and infants safe, healthy, and alive, and legislation in the aftermath of Dobbs v. Jackson will now add death by unsafe abortion to the many hazards women are forced to face in this state. Instances of children residing in Louisiana being shipped to juvenile detention centers in Mississippi, in spite of the fact that such practices are violations of state and federal laws, demonstrate that child incarceration there today is simply a business practice in which the state's sons and daughters can be exploited for profit with little more concern for their welfare than the state demonstrated 200 years ago when it used enslaved children as young as 5 years of age to harvest its cash crop of cotton. Not even the necessity of life-saving care is stipulated in Tennessee's anti-abortion legislation, but instead it states a physician may defend himself or herself against criminal charges by demonstrating that the abortion was necessary to prevent the death of the pregnant woman or to prevent serious risk of substantial and irreversible impairment of a major bodily function of the pregnant woman. It, like a few other states so eager to refuse women and children the right to choose the course of their own destinies and economic futures, has also refused to expand its Medicaid program to meet the healthcare needs of women living in poverty, although this funding is readily available from the federal government. Alabama's school-to-prison pipeline suspends, expels, and arrests Afro-American children at more than 3 times the rate of white children, with statistics further revealing that approximately a quarter of Afro-American students with disabilities within the Alabama school system have been suspended at least once.